Okay, hello. Today we will present a scientific poster on the search for new pharmacological treatments for glomerulonephritis and epidemiology in Mexico. The team is made up of Aldair Castañeda, José de la Rosa, Ramiro Domínguez, and Cristal Ramírez. Okay, in the present investigation, the issue of glomerulonephritis will be AIDES, mainly reviewing the new pharmacological treatments as well as the epidemiology and growth most affect in recent years in our country, Mexico. Mainly in the present investigation, the most up-to-date information on the aforementioned subject will be given.
Introduction. Glomerulonephritis is currently a public health problem worldwide. This is because its prevalence and incidence have been increasing in recent years. This is due to demographic change, lack of information, and early diagnosis of the disease. Abnormal behavior of this disease can be reflected in the decrease in the volume of filtered blood, loss of selective filtration, and loss of filtration, which lead above all to the elimination through the urine of different foreign elements of the blood and of substances that ordinarily they are not lost in minute amounts. In addition, it is important to follow up on this problem since it is necessary to mention one of the main causes of it, which is that can generally lie in a defective behavior of the immune system. The pathological behavior of T lymphocytes with direct damage to the basement membrane might be the origin of minimal chain glomerulonephritis.
Methods. A search was carried out in books, articles, governmental web pages of the Ministry of Health on the new pharmacological treatments of glomerulonephritis, as well as the epidemiology and most affected group in Mexico. Only the most up-to-date information on epidemiology and treatments was taken, as we want to show the community the most up-to-date information on our topic. In this way, we were able to collect the useful and necessary information for our documentary type investigation.
In the results, the new ways of treating kidney disease works that promote different transplant options and the promotion of humanization and dialysis have been the winning project of the Íñigo Álvarez from Toledo Nephrology Research Award that are convened annually by the Renal Foundation in Spain. A study that opens a new avenue for the treatment of glomerular inflammatory kidney disease, glomerulonephritis. Researchers have discovered that a podocyte membrane receptor, la GPRC5B, modulates the inflammatory response in the glomeruli. This finding opens a new door to the search for drugs that inhibit this receptor and therefore to development of the new treatment against the disease. The study of the GPRC5B modulates inflammatory response in glomerular disease, way NF-κB pathway, validate both in mice in which the receptor has been eliminated, and in human podocyte cells in culture has been carried out by the team led by Dr. Sonia Zambrano from Karolinska Stockholm Institute. The podocytes are specialized epithelial cells attached to the glomerular basement membrane and the essential part of the filtration barrier, which prevent the loss of serum protein in the urine. Epidemiology of the glomerulonephritis in Mexico and the most affected group. According to a study, all the native kidney biopsies and analyzed from January 2003 to December 2011 from patients older than 16 years, establishing the clinical characteristic, the form of the presentation, and the histopathological report. There are 163 biopsy reports. The mean age of the patients was 32.6, 13.3 years. There were 55 women. 24% present systemic arterial hypertension, and 10% a family history of chronic renal failure. The most common primary glomerulonephritis was focal segmental glomerulonecrosis. 47 and membranous 50%. The most frequent secondary GMN were lupus nephropathy, 14%, amyloidosis, 1.2%, and diabetic nephropathy, 4%.
Conclusion. In conclusion, we have that EEFI is the most frequent glomerulopathy in Western Mexico. This is increasing over time regardless of ethnic groups, with a prevalence that was in the year 2000 with a 2.3% and increased to 4% in 2011. The way to diagnose is when the filtration work carried out by the glomerulus structure supposes not only elimination of water but also selectivity of substance present in the blood. Any alteration that arises in the anatomical and psychological structure will lead to anomalies in the filtration work carried out. In a first clinical evaluation, the existence of absence of proteinuria must always be assessed at will as its quantification. The presence of associated hematuria, the development of renal failure, and the existence of arterial hypertension. The importance of renal biopsy lies in the fact that it allows us not only to know where the histological involvement is or what mechanisms are involved, but also the degree of severity of site involvement, a crucial point when starting and deciding what type of therapeutic management is required. Clinical criteria can be used, but the diagnosis requires histological confirmation. There is one exception: minimal change disease in children. It considers a positive response to steroid treatment diagnosis. Finally, although glomerulonephritis is a very common disease, there is still debate and lack of evidence about this etiology, so research is still being done on the causes that could develop it. What we do know is that it is a serious public health problem, and it is important to prevent it by managing associated comorbidities and lifestyle habits.